Chapter 18, Planning Nursing Care. You need to establish priorities. Ordering of nursing diagnoses or patient problems uses determinations of urgency and/or importance to establish a preferential order for nursing interventions. Organization of a vision of desired outcomes. We need to classify our priorities. High is emergent, life-threatening. Intermediate is non-life-threatening. Low affects patients' future well-being. So the order of priorities changes as a patient's condition changes. Priority setting begins at a holistic level when you identify and prioritize a patient's main diagnoses or problems. Patient-centered care requires you to know a patient's preferences, values, and express needs. Ethical care is a part of priority setting. So methods for prioritizing. Importance, high. These are nursing diagnoses that, if left untreated, result in harm to a patient or other. Think about Maslow's hierarchy of needs. Intermediate are non-emergent, and non-life-threatening. Low is not always directly related to a specific illness or prognosis, but can affect a patient's future well-being. Review patient priorities in the care plan each time you see the patient. So here's priorities in practice. If you look at your circle, here's how we assess, identify, prioritize, and deliver patient care, and then evaluate that care. All of the outer parts of the circle come into play. So here's your case study. I want you to think about this. Fumal is a first semester nursing student who's assigned to this patient. Think about this. Why aren't anemia and peptic ulcer a part of the care plan? Remember this. Care plans do not directly address medical diagnoses. Medical diagnoses are different than nursing diagnoses. So in critical thinking, we need to set goals and expected outcome. So a goal is a broad statement that describes the desired change in a patient's condition, perceptions, or behavior. They can be both short-term and long-term. They are often based on standards of care or clinical guidelines established for minimally safe practice. So we need to involve the patient in goal and outcome setting. You always partner with the patients when setting their individualized goals. Mutual goal setting includes the patient and family or significant others when appropriate in prioritizing the goals of care and developing a plan of action. Act as a patient advocate. Select goals and expected outcomes based on nursing sensitive patient outcomes and nursing outcomes classifications. Writing goals and expected outcomes, goals need to be specific, measurable, attainable, realistic, and time sensitive. Quick quiz. A patient is suffering from shortness of breath. The correct goal statement will be rewritten as which of the following? Critical thinking and planning nursing care. Nursing interventions are treatments or actions based on clinical judgment and knowledge that nurses perform to enhance patient outcomes. So nurses need to know the scientific rationale for the intervention, possess the necessary psychomotor and interpersonal skills, be able to function within a setting to use healthcare resources effectively. So Fulmala develops Ms. Skyfall's plan of care, including writing the goals and expected outcomes. She knows the guidelines for writing goals and expected outcomes include that they be specific, measurable, and realistic. So nurse-initiated goals are independent actions that a nurse initiates. Healthcare provider-initiated or dependent. They require an order from a physician or other healthcare professional. Collaborative goals are interdependent, require combined knowledge, skill, and expertise of multiple healthcare professionals. Nursing interventions classification. The Iowa Intervention Project developed a set of nursing interventions that provide a level of standardization to enhance communication of nursing care across healthcare settings and to compare outcomes. The NIC model includes 3 levels: domains, classes, and intervention for ease of use. NIC interventions are linked with the NANDA International Nursing Diagnoses. So, nursing interventions classification. The 7 domains are the highest level of the model, and broad terms are used to organize the more specific classes and interventions. So, FOMALA knows that what type of interventions require an order from a physician or another healthcare professional. Student care plans. Student care plans are useful for learning the problem-solving technique, the nursing process, skills of written communication, and organizational skills needed for nursing care. Student care plans help you apply knowledge gained from the nursing and medical literature in the classroom to a practice situation. It is more elaborate than a care plan used in a hospital or community agency because its purpose is to teach the process of planning care. So planning care in a community-based setting involves educating the patient family about care, guiding them to assume more of the care over time. So how do we consult other healthcare professionals? We consult with members of the healthcare team when you face problems in providing nursing or collaborative care or in delivering dependent interventions. So think about, when do you consult? How do you consult? And then successfully planning equals patient participation in the care. So FOMALA's clinical coordinator tells her to coordinate with the nutritionist to develop a meal plan for Ms. Skyfall. So when and how to consult. Begin with your understanding of the patient's clinical problem. Direct the consultation to the right professional. You need to provide the consultant with relevant information about the problem area, a summary, methods used to date, and outcomes. Do not influence the consultant. Be available to discuss the consultant's finding and incorporate their suggestions into the plan of care. Quick quiz. Consultation occurs most often during which phase of the nursing process?